disappointed at the response of our city. I'm disappointed at the response of our state. When I looked and I heard that the governor was putting together a task force around racial disparity, I said, finally, somebody gets it. Finally, somebody gets it. And there's going to be a spotlight on people of color so that we can see why are we dying at such disproportionate rates. And then it turns around, when I looked at the list, it read like a who's who of people. And I'm like, what can they do? I was disappointed. I was saddened. Half of these people don't live in any of the neighborhoods in the city of Detroit. Half of the people, their income is probably 10 times over the average income of the people here in Detroit. So can you tell me, how are they directly impacted? For over a month now, I've been trying to have a conversation, me, myself, and others, around COVID-19 and the effect of it in the prisons. The fact that we can't do social distancing in the prisons. And how are we going to work that out? What are we doing? What is our rapid response to COVID in our prisons? And then we read in the paper, it's not on the list of the governor's priorities. They're people. Why not? Those are our people. Those are our cousins. Those are our mothers. Those are our fathers, our brothers and our sisters. Why not? Why is their life not a priority here in Michigan? So I'm sitting here and I'm sitting in this tension. And I sit in this tension every day, knowing that people are putting lives, other people's lives that have never valued the lives of the people that's being put in their hands, and knowing that they've been given the task of saying what's good for us and what's bad for us, given the task of saying they live or they die. I've been in the hospital with great insurance. And I myself have been sent home to die, not because I lacked insurance, but because of the color of my skin. And I wonder how many people have died during this COVID-19 Detroit, have died because of the color of their skin. So I hope that we answer some questions today. I hope we answer some real questions and we come up with some real solutions, because we are the only ones that are coming to save us. It's about a number and a policy for them, because at the end of the day, they're going to pat themselves on the back and say what they thought that they did. But we're going to be here left to bury our dead, to clean up the war zone, to nurture our children out of fear into fight. So thank you so much. At this time, I'm going to introduce to you Lakeisha Morse. She is our moderator for today, and she's going to take us further into this crucial conversation. Lakeisha.
Thank you, Elder. My name is Lakeisha Watson Moore. I'm the blogger called Bougie Black Girl. I'm a mom to 2 wonderful boys. I'm a political activist. I happen to be Sinead Watson Whitaker's twin, who's also here. And I'm your moderator. Shirley Chisholm once said, if they don't give you a seat at the table, bring a folding chair. Today, we're bringing out chairs. I'm moderating a conversation called COVID-19 in Detroit, Death by Racial Disparity. First of all, I'd like to thank Michigan United Political Healers and Faith and Justice teams for hosting this event. I'd like to thank our distinguished speakers and panelists for sharing their ideas and experiences. And most importantly, I want to thank you, the audience, for being here. The panel will go as follows. We'll ask our 3 brave individuals who've been directly impacted by the COVID-19 virus to speak. Next, we'll transition to our panelists and we'll answer questions. And because this is really about you, we'll go to the chat box and we'll take your questions there. So Just remember, put all your questions in the chat box, and don't forget to mute your phones. Thank you, and let's begin. As you know, African Americans make up 14% of the population in Michigan. Unfortunately, they're also 40% of all COVID deaths in Michigan. Each of our panel members have been touched by this plague, and I have too. I've lost a friend. In this conversation, we're going to find out why there's a huge racial disparity, and we'll discuss solutions that we all can personally take to stop this plague from destroying our community. Today's panel includes some of Detroit's most important and valuable voices. These are the people that are on the ground. These are the people Michigan needs to hear. This is our table and our chair. So right now, I'm going to introduce you to the three brave individuals who've been personally impacted by this plague. Keon, he's a frontline worker, and I'd like for him to go first.
Okay, there you go. Can you hear me?
We
Yes.
can.
Okay, good. Hello, everyone. My name is Keon Harris. I'm I'm an essential worker in the produce sector. I have a few major concerns that have been going on since COVID-19 has arisen. So far, we've only had a few small changes at my job, such as wearing gloves, face masks for all workers. There's been some enforcement as far as keeping customers 6 feet apart, and also with small signs, saying practice social distancing and such. But there's been no major changes. One thing I know, not just for my store, but for all grocery stores, there's no capacity, like a limit to how many people can come in to the store. And that's obviously very unsafe. On a typical day or a typical week, I pretty much work 6 to 7 days for the most part, while being in school as well. So that's pretty exhausting for the most part. I would say trying to keep a balance between school and work. So
Have we lost Keon? Oh, there he is.
oh yeah, can you hear me?
Yes, we can hear you now.
Okay. Like I was saying, I work with majority Hispanic and West African and different immigrants who are all pretty much above the age of 60 and above for the most part. So I would say I have more of a concern for them as to myself, since they are, obviously older age, and they also have families to support. Um, One thing that I would say, this pretty much working 6 to 7 days not only affects their physical and mental health, but it pretty much they're in contact with people every single day. We're in contact with hundreds of people every day, and so they're risking not only their families but themselves. Since the outbreak, we've had a hazard pay, which has been an increase of $2, but it doesn't bring us to even 15. So the main thing is, like, the question I would have is the compensation worth the risk that we as employees are on the front line? Is it worth it?
Thank you. Thank you so much, Keon, for
Yeah.
sharing your story. I'd like to speak to, I'd like for us to speak to Ms. Keena Williams. Keena, are you there?
Yes, ma'am, I'm here.
Thank you, Keena. Please share your story.
Okay, first I'm gonna tell you, I lost my sister to COVID. This is my sister. She was a direct care worker. She had 2 jobs. She was also a mother, a wife, and she's a native Detroiter, but she has moved to the suburbs. But she had drove herself to the hospital, and she was fine for a couple of days. And then, like, then her breathing started, she went in there for like, she had a fever. She's a diabetic too. I'm sorry to tell you, I forgot. And she went in there because she had a fever and she wasn't eating. And she was okay, like I say, for the first couple of days. But then, like the third day she was in there, she was struggling to breathe. And I had some concerns because of the doctor. They said her vitals were stable, but she was struggling to breathe. It seemed like they didn't give a care or whatever. I asked them could they X-ray her lungs, and the nurse told me that if the doctor felt it necessary, they wouldn't do it because of a patient or a patient's family member called in. So the next day, my sister was put in ICU, and I had went up there, but I couldn't get in. And that was the last day any of us spoke to my sister, which was March the 24th. And unfortunately, my sister passed away, like I said, the obituary on the March the 31st. Oh boy. So like, now I'm gonna tell you about me. Like, I began to get sick around the 5th of April or whatever. I had the symptoms. I kind of knew something was wrong when I lost my sense of smell. Oh, I'm sorry, y'all. So I'm 44 years old. I have diabetes and hypertension as well. I'm a Detroit resident. I guess I'm a community activist. I feed the homeless on my own dime. I'm a cook by, well, that's what I do for a living. And, like I said, April the 5th, I started feeling symptoms like the first one I felt was the no taste and no smell or whatever. And then I didn't get hungry. And then my breathing was bad. But this was before I got tested. I wanted to make sure my sister was laid to rest the proper way. Her funeral was April the 11th or whatever. Like I said, but I had symptoms, but I wasn't tested. So I buried my sister, and I think the 17th of April is when I got tested at McLaren, and the lab called me back 2 days, like it was on a Sunday, and they told me that they were calling the people that tested positive or whatever. So, she told me I tested positive for COVID, and it's just been horrible. It drains you. I've had all of them. It's like my heart racing, and I had to be taken by EMS to the hospital twice. The first time it was it's always because of my blood pressure, because it's like, messing with the illnesses that I have on top of the illnesses that it causes or whatever. And I'm just dealing with that, and it's just horrible. It's just, I'm afraid. I'm afraid, you guys. I was so afraid that I called the funeral home for myself. The lady, she couldn't believe it, but I'm that afraid, you guys. I just got released from the hospital last week. They said I had pneumonia in my lungs or something, and they said they could see the COVID. But like I said, I went because my chest was tight and my blood pressure was high. But I'm been in quarantine. My brother's been taking care of me. But I feel a little bit better, but I know I got a long way to go. I got nurses coming out to take care of me too.
Thank you, Keena. As you can tell, these are real people with real, what's going on has real consequences. Thank you so much. Next is Vicki Dobbins. Is Vicki Dobbins here?
Yeah, I'm sorry.
It's okay.
I think I was muted. Okay.
It's okay.
So, hi. Yes, I've been listening to the stories, and all of them seem to be very close to the same story that I'm going to give you. This is Vicki Dobbins. I'm from River Rouge. I am a school board member, substitute teacher, and an advocate for clean air in River Rouge, Southwest Detroit, and Ecorse. First of all, I like to give thanks to God and my family, Rhonda, Roz, Vernon, Rhonda Anderson, Rhonda Adams, Mr. Ron Dupree, to the Sierra Club, NAACP, River Rouge School Board, Dr. Coleman and the administrators, the precinct delegates, Reverend Sheffield, and especially to my special group, the Ida Wilders. These people have prayed for me, and without their prayers, trust me, I'll say it a different way. They prayed for me and Jesus heard them. Okay? Jesus was listening. So, upon entering the Henry Ford Hospital here in Wyandotte, they sent me home. They tested me and they sent me home. I tested positive. And that was on a Thursday. Friday, I was feeling so bad until my daughter called my primary doctor, who called the Henry Ford hospital downtown, the main hospital. She set it up for me. Thank God for Dr. Joyce Leon. So after a lot of persuasion from my daughter, I got up and I went to the emergency room downtown Henry Ford. I went into the emergency where I stayed for 8 to 10 hours. And when I left there, I went directly to ICU, where I was placed on ventilators. I was given IVs. I was given blood, a lot of oxygen. Blood was drawn 3 to 4 times a day. Testing my levels, whatever it is that they test with blood. My blood pressure would fluctuate from way too high until much too low. After a while, they decided that I may need to be put on kidney dialysis, where I was given at first 3 treatments of dialysis, and then they put the port in my arm. They gave me 1 more treatment, and they came back and said, Ms. Dobbins, I don't think that you're going to need the kidney dialysis. I said, hallelujah. So I was in the ICU for 2 weeks, and then I went to isolation for 2 weeks. On April the 7th, they gave me the opportunity to either come home or go to a nursing facility. I decided to go to a nursing facility because my blood pressure was so out of control. I was having trouble breathing, and I needed to be more stable than I was. I didn't want to leave the hospital, come home, and I wasn't stable. So during the time that I spent in the nursing home, and thank God, oh my God, thank God for the nurses, thank God for the aides, thank God for the people who come in and put their lives in jeopardy to take care of COVID-19 patients. Let's don't forget them, guys. When we're praying, pray for those ladies, okay? So after 2 weeks in the nursing home, my blood pressure became stable. My coughing became more stable. I'm still coughing, and Still have a little mucus, but not like I was. And so there, so it's been a whirlwind. Now, the one problem that I'm having with being discharged from the nursing home is that I have come home to my family and I was not tested a second time. And I don't understand how you can test me and know that I'm positive and use the number of 14 days. I've been in the hospital for over 6 weeks. Am I still positive or am I negative? I don't know. But I'm released to my home, to my family, and with this big question mark behind my name. So we need to make sure that everyone, if you're tested positive the first time, then there should be a second testing when you come home to your family. You don't want to spread that disease, okay? So one thing that I want to leave with everyone is the things that can happen after I come home and after I think that I'm well. I may accumulate poor circulation in my legs. I may have kidney, liver, and heart problems after COVID. I may still need to go on the kidney machine. I'm not really positive about that. But with all these things, I just like to say to the listening audience, when you become ill with this disease, please take some time, go to the doctor, go to the hospital, check yourself out. This pneumonia, and I did have pneumonia, this pneumonia will take you out so fast until you just won't believe it. So go ahead, I'm ready for any questions that you have.
No, thank you so much. Thank you so much, Ms. Vicky. Thank you so much, Keenan. Thank you so much, Kenyon. We really appreciate you. You guys have told stories that are needed to be heard. Thank you so much. We're going to move on to the panel now. I would like for everyone to introduce themselves. Could you tell us what organization you're with? How has the COVID-19 plague personally impacted you and your communities? And what we can personally do to empower ourselves. Our first panelist is Sinead Watson-Whitaker, who happens to be my twin sister. Could you tell us more about how it has impacted you and what organization you're with?
Hi, my name is Sinead Watson-Whitaker. I'm actually not with an organization. I am a Detroiter. I am an activist, and I am also a lupus patient. Because of Trump's policies touting hydroxychloroquine as a miracle drug, this is also the same drug that is being experimented with people at Henry Ford Hospital. There's a shortage, and I need this drug to survive. In March 23rd, I tried to fill my prescription, and I am unable to fill it. I am not sure how I'm going to get my prescription and when. And right now, because of all the drama with this medication, I don't know what's going to happen next. Right now, politicians are still pushing this medicine, but my people are still dying. Every day on Facebook, I look, read my timeline. There's a daily obituary or tribute to someone I know. Also, in the last month, 8 people I know, including my cousin, died from coronavirus. With my cousin, he did the same thing that the other speakers talked about. He went to the doctor, he wasn't feeling well. The doctor said, go home, you'll be fine, gave him some antibiotics, diagnosed it as, a flu. And my baby cousin found him dead in his bed the next day. 2 weeks ago, my 21-year-old daughter, she told me she had a cold and she wasn't feeling well. She had a virtual appointment with a doctor. Again, you know, you speak to your doctor, same story. She had that virtual appointment. The doctor told her she had a cold and to stay home, you know, just stay home and act like you have COVID, but you don't. But when I told her this, I told her to get a test. I insisted on her getting a test. She tried to get a prescription from her doctor. After she spoke with me, the doctor refused. She had to basically finagle the system and say, well, I was exposed to someone with COVID. And now test comes back, she does have COVID-19. And another point for me is, at one point I worked for the Detroit Health Department, so I understand government's response to infectious diseases. I'm also always thinking about politics and what we can do as a people politically. So I'm here to encourage you to engage your public officials, become active by joining Michigan United, and basically holding your government accountable. Elder Leslie talked about earlier the people who are on this COVID response task force that was created by the governor, that's headed up by the lieutenant governor. I know of a number of those people, and I've actually had conversations with them, but I think that they have to do a better job of including people who are on the ground and in the community that know what's going on, people who are, you know, out there in these streets. You know, like I said, a lot of these people that they have there, they don't have their ear to the ground and they don't know what's going on. And I don't know if they've been personally impacted by COVID, but I just have a problem with people who should be there, sitting at that table, being there. So I just thank everyone for including me in this discussion, and I thank my twin as well. Thank you.
Thanks, Shanae. Up next is Ms. Deborah Burke.
Hi, thanks so much. Good afternoon, and thank you for inviting me to be a part of today's panel. I have a master's in psychology, which allows me to teach college credit psychology courses. One of the places I teach is at Women's Huron Valley Correctional Facility, which is the only women's prison in the state of Michigan. I'm also a Detroit City resident. I live in the 48221 zip code, which is one of the top 2 zip codes for infection in the city. On my block, we have had 7 of our neighbors that have tested positive. Unfortunately, one of our neighbors passed away. A neighbor right next door to me went to the hospital with digestive symptoms. He was told to go home. He had gallbladder issues that would resolve themselves. He returned to the hospital a few days later and tested positive for COVID. I'm happy to report that he is home recovering. He goes out and takes walks a few times a day, and his wife is also positive, so she is doing really well and recovering also. I've dropped off food, made masks, checked in with phone calls, and tried to do everything I could to support my neighbors during this very difficult time. It's not lost on me, and I'm very grateful that I have a job that allows me to shelter in place, work from home, and support my friends, family, and neighbors in this way. However, I've not been inside the prison since the end of February, and I'm quite terrified for the women that are in the prison right now. It's important to think about the conditions inside the prison before the pandemic. There are water and air quality issues, accessibility and availability to phone issues. There was a scabies outbreak that went on for 2 years that went undiagnosed. Menstruating women aren't giving very many pads. They have to buy more or barter. Pregnant women are shackled during transport, aren't allowed to breastfeed, postpartum. Healthcare is accessed by sending something called a kite, which is just a little note to say that you need some help. And then you just sit around and wait for a response. There are co-pays for prisoners to see medical care. Many prisoners don't have outside resources. Some of them have jobs within the facility, but they're paid pennies on the dollar. So as in community, for many people in prison, healthcare is difficult to access and unaffordable. Same as out in community. When I was in the classroom prior to the pandemic, the biggest fear that students shared with me was a fear of a personal medical crisis, cancer, heart attack. They never in their wildest dreams could have imagined a global pandemic. Women's Huron Valley is an overpopulated space, so social distancing is impossible. People are isolated, programming is shut down. So prison is very traumatic and isolating, but all the programming that might make this space bearable is gone. And if you are positive or you are in a space that was someone's positive, you could be quarantined and all your things would be stored. So you have no access to your personal items and quarantine. It's just a really, really difficult environment. So I just want to end by talking about connecting the fact that the meatpacking industry and also prisons are getting a little more press, and I think that's important. Last night, the president, Trump, issued an executive order giving legal cover to the meat industry. And I'll just end it here by saying that stating the obvious, which is these environments, what do they have in common? The people who live and work there are predominantly Black and brown. Thank you for giving me an opportunity to speak today.
Thank you so much. Next, we'll speak to Dr. Lisa Jackson.
Good afternoon, everybody. I'm Lisa Jackson. I'm a native Detroiter, now living in Ann Arbor, Michigan. And in Washtenaw County, Black folks make up about 13% of the population, but we account for about 46% of COVID infections and about 50% of COVID deaths. So our statistics here just across the Wayne County line are kind of similar to Detroit, which I know is surprising for a lot of people. I teach psychology to undergraduates. I teach surgery classes to graduate students at the University of Michigan, but foremost, I am a researcher. I got into research because I was really interested in how medications, like lithium, for example, that's used for bipolar disorder, work differently on Black folks, Asian Americans, and white Americans. For a long time, I worked for the Project for Research on Black Americans at the University of Michigan, and I studied how health issues were different for Black women than they were for other women. But like many of you, I wear lots of hats. I do work for the University of Michigan Medical School, studying how to eliminate health disparities. But more important than health disparities are health inequities, which is a really different thing. And these things include things like why when white kids go to the doctor with a broken leg, they get morphine for pain treatment, but when Black kids go, they're just given Advil. That's an inequity. That's not a health disparity. I've also done work in epidemiology and public health. And until recently, I helped run a homeless shelter for children here in Ann Arbor. Now I am the chair of the Community Police Oversight Commission here in Ann Arbor. And I also worked at a maximum security correctional facility. I'm also a wife to an African-American man with type A blood, which is the most vulnerable to COVID. And I have 2 children. Thankfully, all 3 of those people I do not have COVID at this time. However, I have lots of family in Detroit, some of whom who have tested positive. So this is not a theoretical discussion for me. It's not a research question. This is a real life question for me, something that I think about every day. And issues like COVID just kind of bring to bear all of my areas of expertise and much of the work that I've done. As a psychologist, though, one of the things that has most disturbed me is the media coverage of Black folks in Detroit that communicates on the one hand that our rate of infection of COVID is higher, but at the same time shows videos of us gathering together as if somehow social distancing and disobeying social distancing rules is why we have higher rates of COVID. As if years of systemic lack of access to equal health care, as if years of ignoring the fact that we don't have equal opportunity to healthy, affordable food, to safe spaces, have nothing to do with our rates of infection. As if the constant state of racism in this country has nothing to do with our rates of infection. So I'm going to loosely paraphrase James Baldwin here and say that to be Black and aware in America is to be constantly angry. And if our rates of hypertension, people act as if our rates of hypertension, diagnosed or not, aren't related to our rate of infection. So, our behaviors aren't so pathological as much as many of the systemic pre-existing underlying conditions that impact us socially, psychologically, and biologically are much more related to our rates of infection. We know that hypertension is related to deadly outcomes for pregnant Black women, including near fatal outcomes for wealthy Black women like Serena Williams and Allison Felix. We know that hypertension is related to adverse outcomes for our babies. No matter how educated and wealthy we are, our rates of preterm low birth weight babies are sky high. They are higher than those of white women who have only a high school education. Research out of Howard University in the 1990s followed regular Black folks as they went about their lives. They showed how blood pressure and heart rate increased when they went into a job interview, when they went shopping and were followed in stores, and when they put up with microaggressions at work, everyday stuff. So we have known since then that blood pressure rises in the morning and decreases in the afternoon for white folks, but stays high all day for African Americans until they go to sleep at night, and then rises again as soon as they get up in the morning. It is no wonder why hypertension is so much higher in African Americans, and we all know that hypertension is a significant predictor of the severity of COVID if you contract the disorder. And it is likely related to our vulnerability to getting infected in the first place. We have known for decades that racism is a killer, and that is evident in this pandemic as we are disproportionately hit. So what can we do? I'm going to echo some of our previous speakers. I'm going to say we need to be vigilant. We need to use our knowledge. We can refuse to accept the rhetoric that the way we live, the way we love, the way we define family is somehow pathological. It is not. We can refuse to accept that the high rates of COVID infection in our communities are our fault. For hundreds of years, Black folks have created family. Family is not just a husband and a wife and 2 kids in your house. For hundreds of years, for as long as slavery, we have decided who our family was, and that is often extended family. During slavery, as kids were ripped away and marriage was forbidden, as women were raped and impregnated, as families were deliberately torn apart, creating family was the only way for us to survive. That continues today. In the 1950s, policies that denied social services to families with 2 parents forced families to choose. Are they going to have a dad in the house, or are they going to be able to feed their kids? Today, over 70% of Black households are female-headed, and it's no surprise. But that system wasn't designed by us. It was forced on us. And despite that, we sustain families and extended families as we always have. So as we suffer under policies that are detrimental to us, think about raising, a few years ago, Social Security decided to raise the age at which you could collect full Social Security benefits. And that age was higher than the estimated life expectancy of Black men. Yet family continues to sustain us. We know that family, extended family included, is important to us. So as we protect ourselves from COVID, we need to create culturally appropriate strategies that work for us and include our extended families. We know that symptoms present differently for African Americans. This is true in so many cases. This is not anything new in the medical literature. So we need strategies to reduce the degree to which we get turned away because we don't seem to present with the correct symptoms, only to then die one day later. This has happened over and over across this country. We need to use the power that we do have to hold our leaders accountable. We need to call for release from jails and prisons for people who will be paroled in the next few months anyway. We need to call for release from jails for people who are in jail on technicalities, such as driving with a suspended license or missed parole officer visits or curfew violations. We need to raise our voices about the budget cuts that you all know are coming. And they're going to threaten the very few social services that we do have. They're going to threaten child food programs. They're going to threaten education. We have the considerable power of our voices to hold those in power to be accountable, and we need to use it. We need to shut down the dialogue that suggests that our cultural practices are the problem. They're not. We need to raise our voices to demand culturally appropriate strategies. We need to demand access to testing for everyone. And we need to demand access to culturally appropriate diagnosis and treatment. We need to demand the resources that we deserve as citizens of this country. Clearly, we are all we have. Thank you.
Thank you, Dr. Lisa. Of course, they don't know about it. We have play aunties and play cousins too, and those are our people.
Those are our people.
That's our family.
That's right.
Next is Dr. John Duckworth.
Hello, glad to be a part of this discussion. I am wearing a couple of hats today. One, I'm a pastor of the Gethsemane Baptist Church in Westland, but also I am the chair of the Health and Human Services for the Council of Baptist Pastors of Detroit and vicinity. And definitely Dr. Jackson basically said a lot of things that I was going to say, but yes, this issue that we face has a lot more to do with the environmental, economic, and health injustices that we face as a people than any kind of stigma or any kind of, as some doctors are suggesting, sometimes are suggesting that there's something wrong with our makeup. Nothing wrong with our makeup. You put incinerators in the middle of a suburban city. You put trash dumps and those things in the middle of a suburban city, and you have the same effects that you have what happens across this country all the way around. Doesn't matter what city you are in, you can always tell where we are placed. So these things are systematic. These things are part of the systems of racism that has had an effect on us. And so now America's dirty secret is out. It is being exposed to the hilt of just the digital divide and all the things that we counter, all the things that we deal with. And so it is time for us to make some noise. It is time for us to come together and strategize with a informative but intentional cry for justice. I just believe no justice, no peace. And so at the end of the day, there has to be some smart dialogue that deals with the facts of where we are. And of course, you know, people are not listening, but no one said anything about the folks that went up to Lansing protesting last week. They were not practicing social distancing either, but nothing is said about them. So we know how it happens. We know how media often plays into that. To remind me of the words that was used in Eddie Murphy's movie, we're not gonna fall for banana in a tailpipe. It's time off of that stuff. We know what we need to do. We need to come together. We need to make a noise. And I thank God for this platform where we can have real live discussions. And that's why folks are trying to interrupt us, because they don't want to hear. I mean, this is the thing that always gets me. You say we're not doing anything, we're not productive, and then when we try to get productive, you always want to interfere. So obviously, what is it? If we're not doing anything, leave us alone. Obviously, we are doing something. So we understand the fight that we are in, but we thank God for all of those that are on the front line, and our prayers are for all of those that have suffered from this tragic virus. I have not had any personal family members that have lost to it. I've had some that have had it, but I had a very good friend, my best friend of 40-some years. His sister succumbed to this disease, and as a pastor, I've lost several within the congregation, and I've had more people that have been on the other side. They are now rejoicing, and we're celebrating with them, but it has made an impact, and unfortunately will continue to make an impact. And I'll say this: whenever profits are put over people, you're going to have problems. The Bible mandates that, and so that's the problem we're dealing with now. 45 is more concerned about the profits than he is the people. But sooner or later, it's going to come around. So I'm just waiting for the Lord to do what the Lord is going to do. Thank you.
Thank you so much. All right, Ms. Deborah, there is a huge stereotype about the folks that are going through Corona. What does your community look like? Because you said your neighborhood had the highest rates there. What does it look like? And tell me about the people there so we can dispel these stereotypes.
Here we go. Sorry about that, everybody. So 48221 is seen as a affluent area. I live in the University District. And so my neighborhood is predominantly Black and brown. I think I'm the only white person on my block. So the neighbors I spoke about are Black and brown.
Mm.
We don't have the data yet. And the look back on why 48221 and 48235 have the highest rates of infection is something that is going to have to be studied. I can only speculate. So I just want to say what I'm going to say I'm speculating at this point. One thing is that it could be a population density. It could be where a large, like it's a community, most of the houses people are living in, there could be a population density thing. People could have relationships with doctors in these neighborhoods that don't in other areas. It also could just be a matter of, it's not that there isn't a higher rate of infection in another zip code. That zip code just isn't getting tested as much as this zip code. So then the question becomes, why is this zip code? What do we need to study about the zip code that informs us about what we need to do in other zip codes? So those are just kind of a few speculative things that I thought about. Also could be the work that people do. Their schedule allows them to be tested. They have health insurance. I just think there's just a myriad of variables that could impact that.
And Lakeisha, could I jump in here too for 1 second? I just
Sure,
want to
go
say
ahead.
that, you know, we're always talking about rates of infection, but we're really only talking about rates of who got tested.
Right.
And so it may be that more people in 48221 got tested than in other zip codes. And that's, we keep doing that all the time, talking about, oh, there's more here. Well, there were more tests there. So even like in the Huron Valley Women's Prison that Deb was talking about, you know, they'll report one case. Well, they only tested one person. So we don't know what the rates of infection are because everybody hasn't been tested and everybody's not getting tested and everybody can't get tested. And you have people not so much here or in Detroit, but we're told don't come in for a test because we don't have room for you, kinds of things like that. So it's been hard to get a test. And so I don't think we know what the rates are anywhere because we haven't tested everybody. I mean, there are no mobile testing units here like there are in some other communities, and there could be, but there's not. So what if we found out that, you know, some other zip code had even higher rates per capita than 48221? We don't know because people aren't getting tested.
Since you're here, Dr. Lisa, all right. You had, no, this is for you. You said that Black people make up 10% of your county's, Washington County's population, but like 50% of the deaths. Yeah. What is going on there and why?
I mean, I think it's what we see all over the country, right? So we're about 13% of the population. We are almost half of everybody who gets infected, but of the people who die. So what that means, just from that little snapshot, and Washington County has been kind of putting the data out there, so they're not hiding the facts. Every week we get something from the public health department that tells us how many people were admitted, what the totals are, who's sick, who's going home, how many people have died, and they're breaking it down by ethnicity and gender. And so we can see that there's a disproportionate number of men who are very sick, but I think that one of the disparities is the severity of the infection. By the time Black folks come in and get diagnosed, they are more severe. I think that probably we have more underlying conditions like hypertension. We have hypertension that's not diagnosed. And so when you do get COVID, that means that your symptoms may be more severe. The incidence of diabetes, not just type 2 diabetes, but type 1 diabetes. There are many adults who get diagnosed with type 1 diabetes as adults. something happens to immune system function such that you no longer make insulin, and then you become completely dependent on taking insulin, and you could be underweight, you could be healthy, otherwise healthy, and now you have type 1 diabetes. And that seems to be happening to African Americans at a rate higher than other groups. So I think a number of things happen that when we do get diagnosed, the severity of what happens to us then influences the number of people who actually come out of it. You know, I want everybody to come out of this, but it seems like in Washtenaw County, at least, more of us are dying once we contract it than other people. So there are fewer of us who are contracting it, living through it, getting better, and then coming home. And so I think probably, you know, decades of lack of access to resources probably contributes to that, so that when we do get sick, we get it worse.
Well, it seems like when America gets the flu, we get the Rona.
Exactly that, what you said.
Exactly what it feels like.
Yeah.
All right. So we talked about Washington County. What's going on in Detroit? Shanae, I want to ask you about the political stuff that's going on there and the state of Michigan. What's going on politically so that we can be more informed about what's happening with the coronavirus? I call it the Rona because, you know. Go ahead.
You know, us Black folks have nicknames for everything. Well, I can talk about what's going on here. We're actually in a process of having our elections. Our elections are in August. So hopefully we can do what other states have done and have actually mail-in ballots for everyone. We talked about earlier, someone talked about earlier about President Trump and wanting to open up businesses. I think since the nationwide narrative has been African Americans dying from disproportionately from coronavirus, I think there's a push by the people on the right to open up businesses because they know that's not, their base is not going to be impacted by this illness. And they also understand that they're profits before people. They also care about, you know, I think the limit in testing politically is also about stopping unemployment. I don't know if you know, once you collect unemployment, you get your unemployment money, and then on top of it, you have hazard money. In some states, people are actually making more from unemployment plus that $600 than they are from their regular salary jobs. So, you know, Tom Wolf, who is the governor of Pennsylvania, said something really, really impactful. He said, the question was asked, well, there are people who are actually making more being on unemployment than they are working. So you know what he said? Well, employers have to pay their people more. I think here in Detroit, we have to mobilize and force our elected officials to invest more money into the budget for the Detroit Health Department. Again, I work there, I can say this, and testing. One of my passions is public hospitals. We have no public hospitals in the city of Detroit, and I think that contributes to the disparities we have today because that contributes to lack of access and testing. You know, for me personally, I was diagnosed with lupus in 2009, but my doctor said that I actually had it since I was 15 years old, and that was in the 90s. So, again, another thing we can do politically here is to force the people who are running for office right now to make this a priority issue. We have state reps here. Our sexy races here are state rep races. We have people running in just about every district. We need to make sure that they have an agenda that shows that they want to close those health disparities. Again, I'm gonna pivot back to the Michigan task force. We need people who are on the ground, who are talking to the people about what's going on here. The governor, God bless her, and Garland, Lieutenant Governor Gilchrist, they speak a certain language. They can't communicate with my child, my children. I have 6 grown adult children. These are the people who are running the streets. They can't communicate with them. Dr. Caldoun can't communicate with them. None of those people that are on that panel can communicate with these young people. They might be asymptomatic or show signs like my daughter has. They can't talk to these people. And I wish there was a focus more on organizing and bringing people in who would normally not be at the table, than there is right now. So I think we need to push our people, our elected officials, and people who are running for office to make sure that we have community voices in that room at the same time. Thanks, Shanae. Dr. Duckworth, I was going to ask you, like, how can folks, eventually this will subside and end and things like that. How can people heal post-Rona? How can they deal with the trauma that they're dealing with now spiritually?
Well, I think one of the things that we have to do as pastors and leaders is we have to realize that prayer works, but I also believe therapy can work along with prayer. And I think that one of the things that I'm going to do is I'm going to bring in some grief counselors and folks from the grief area to come and help people deal, because in this pandemic, we've had several people that have lost loved ones. I just received a text message a minute ago that one of our older members who just celebrated a couple months ago, her centennial birthday. She just passed, just 100. She just passed. And so the frustration for the daughter that she went to see every day, that she was unable to see her mom. And when her mom made her transition, so that's a whole nother ball game that we're going to have to look at. So I think that this will bring on some challenges, but also some opportunities from a pastoral or from a ministry standpoint. But we also have to realize that we have to do a little bit more than just pray for folks. We do have to pray for them, but we also need to get them the necessary help. And we may not be equipped as pastors to handle this kind of situation. So we cannot be afraid to get others who are trained in this area, particularly dealing with this kind of pandemic, to come in and help us out. And we need to debrief as well and deal with this, because it's been hard for me. I'm a hands-on type of pastor who goes to the house, who goes to the families and all of that. And I've lost several that I have not even been able to, the only thing I've been able to do is talk to on the phone, where I'm the kind to get in my car and go to the house and see them. I have not been able to do this. So there is a part of me that feels badly that I'm not able to do as I normally would do, but because I have a family, I have not a set of 9-year-old triplets, I can't take that chance of exposing my family during this pandemic. I have to take this seriously. And so this has been one of the challenges that we have, and just the faith community to understand that Noah did not jump into the flood to test his faith. He and his family stayed in the ark until it was safe. That's what we also have to remember as well. And so, but I think that getting help and bringing in professional help and bringing in some other grief counselors and folks from hospice and things of that nature that can help us deal with this is going to be crucial and essential once things get back to our new normal.
Thank you. I have a question for anyone that wants to answer. How do you feel about neighboring states starting to open? Do you think it's, and knowing the high rates of COVID, especially targeting African Americans, how do you feel about that? Anybody can go with that.
Well, I'll talk about it in the context of prisons. So it was just reported yesterday that the place that has the highest, so they get the award for the most newest infections, so the highest rate of new infections is Marion, Ohio. There's a prison there. 80% of the 2,500 people living in that prison right now are positive. 169 staff are positive. That's right down in Ohio.
For me, honestly, it's all about politics. I know that we have an election in November. Donald Trump wants to win, and he's willing to sacrifice Black and brown people for his victory. I'm just going to keep it way real. He doesn't care. His administration doesn't care. The people who are the Brian Kemps of the world, those people, the people in Mississippi and Arkansas and Alabama, they know what their population looks like. They have epidemiologists that tell them what it's going to look like. So they don't care. It's not their base that's suffering. Now, once it hits the rural counties, then they'll start caring. But at this point, they're like, okay, frontline workers tend to be Black and brown. Okay, we can sacrifice them because we know that's not our base. They're never going to vote for us. We're not going to change their mind. So we're going to roll with it. Plus, they were willing to, there were politicians, the Lieutenant Governor of Texas was talking about, well, we need to sacrifice a few people for the greater good of the economy. That's profits before people. I'm a realist when it comes to politics, and because I've been in this game for about 20 years, and they're willing to sacrifice anybody to reach their goal. They don't care. They have no care in the world. I know Mike DeWine, he's not taking the Trump approach, but he's still a Republican, so I don't trust him.
You know, I want to jump in here and talk a little bit about Alabama, and there's a bright spot in the capital in Montgomery, Alabama. So Stevie Reed is a family friend, and he became the first Black mayor of Montgomery, Alabama in the history of the state of Alabama, which in itself is ridiculous. But although the governor of Alabama had no stay-at-home orders, he not only imposed a stay-at-home order for the city of Montgomery, he imposed a curfew. He has gotten testing, and Montgomery, Alabama is significant in that it is the #2 city in the country of percentage of Black folks, right behind Detroit. And their rates of infection are not as high as Detroit, in part because Stevie he didn't go against the governor, but he preceded the governor in making some really kind of hardline firm stay-at-home orders. And he has utilized resources of the city to get testing out to people and to make sure that people were following the curfew. And so he's not using police to arrest people who are breaking the curfew, but he's using police to say, take yourself home when people are out breaking the curfew. And that's important. There are a number of ways to do that. And so even in a Republican state, you can see there are these pockets where Black people are taking care of Black people and saying that. And we all saw the mayor of Atlanta, who was not consulted about the state of Georgia's, you know, let's go open hair salons order. And she was trying so hard to say, you know, it's not safe, Black folks. It's not like the Rona was here on Wednesday and on Friday it's going to disappear. Just because the salon is open, don't go there. And so I think we look at Ohio, we look at Indiana, we look at all these states around us, and you saw coalitions of states in the East get together and kind of make some organization. In the West, they're getting together and doing that. But in the Midwest, you know, we are surrounded by lots of these states with Republican governors, and there's not much ability to work with them to say, hey, you know, we even saw some changes in Windsor because about 40% of nurses in Detroit live in Windsor. And so they were like, okay, we're going to close the border. You can go back and forth. At first, you could go back and forth if you were a healthcare worker. And then they were like, nope, pick a side, because Windsor was like, gee, you nurses from Detroit are infecting people in Windsor. And so the rates of infection in Windsor, not another state, another country, are higher because of what was happening in Detroit and lack of PPE for nurses here. So I think, you know, we have enough trouble in Michigan, you know, on our own without having to worry about Ohio and Indiana and Illinois, and because the people don't just stay in one place. And so it's really challenging. I know Gretchen Whitmer has been, you know, targeted as having one of the most strict stay-at-home orders, but, you know, we need more even than what she's done. And so I think for us to have to worry about Wisconsin and Minnesota and Illinois and Indiana and Ohio and Pennsylvania is too much.
Honestly, we also have the issue with water here in the city of Detroit.
Yep.
Making sure all people have access to clean water,
Yep.
because that's a problem. And I also, you know, that's my speculation. I'm not an epidemiologist, but I think that also contributed to the high rates of coronavirus infection. In fact, we've passed 1,000 deaths today. We have, at the count is 1,008 people, Detroiters, have died, and that per capita is larger than the city of New York, my hometown. So there's a problem. And that has to be addressed as well. I think that water should not be a policy issue. Water should be a right. You know, when I was younger, and this is a little off topic, when I was younger, I always thought that water should be free. And I think water should be free right now. I think that's something that God gave us. We shouldn't have to pay something that God gave us. But that also has to be addressed. That water issue has to be addressed. Access to clean water. All Detroiters should have access to clean water. If nothing changes, that has to change. And we have to hold our politicians accountable. All people should have access to clean running water. It is a right.
Shanae is absolutely correct. Over 2,800 households in Detroit are without water today, as of this moment. Thank you so much. Right now, we're going to move to audience questions, and I have a few here. David from Facebook, he asked, he said, Lieutenant Governor Garland Gilchrist of Michigan's coronavirus task force is having a video conference featuring the top corporate representatives in Southeast Michigan as his guests. What are your perspectives regarding the choices of the people on his task force? Shanae, you can go first because politics is you.
Again, yes, I understand. Well, I understand why they included business people, but at the same time, that's not addressing the issue. That's just putting a Band-Aid on an ulcer. And the ulcer here is racism, racial disparities, and not including the people who are on the ground. You have, and I'm not knocking anybody. What I see is a class within racism, classism within that task force. These aren't people who are in the streets. These aren't people who are doing what Kiana is doing, giving food to the homeless. You know, we go, there's like a half a mile between Campus Martius and Rosa Parks Transit Center. We need to get to those people who are in Rosa Parks Transit Center, people who work with our homeless population, our impoverished population in the city of Detroit. You know, again, I am not knocking anybody. Some of those people that are on there, I've had conversations, personal conversations with, but at the same time, we are ignoring the people who actually do the work every day, who see this for what it is, who can tell you it's going to happen before it happens. And I hope that the governor and the lieutenant governor understand that the elitism and the impression that they have are doing more of a disservice than helping the people that they need to serve.
Amen. Carl Baxter, one of the commenters, he asked, it's been stated that once we reopen, it's been determined that everyone needs to be tested. Is there a push to make that happen within Detroit? Does anyone know?
No, I don't know at this time. I know that there's been an ease of testing. I mean, when we first started, you had to know somebody who was in contact. You had to be overseas. There were all these stipulations, and I also think that that's also contributed to some of the deaths. You know, that's my speculation. I'm not blaming anybody, but I think that those barriers, those initial barriers in place, did more of a disservice, and that's not a criticism. I understand that, you know, testing is limited, but at the same time, there's a part of my instinct that says that's also contributed to those deaths. And even with my cousin passing away, he did the right thing. He went to his doctor. His doctor was like, well, you know, you may have the cold or flu, whatever, gave him medication, and he was dead in his bed the next day. It was to a point where his mama, who is my aunt, found him dead. Okay, so I don't know what the city of Detroit is doing, the next steps. I just hope whoever's in charge, including Mayor Duggan at this time, they find a way to close disparities and to listen to people who are actually on the ground as well. I can say this on a local level. We need to listen to those people. We need to listen to those organizers and activists who are doing the work, who do the work daily, and not tell him, you know, things that he wants to hear, but things that he needs to know.
Great, great. Now, this was an awesome conversation, and I want our viewers to get to speak to you and get to contact you. So, Dr. Lisa, how can folks contact you on Facebook, Twitter, or wherever?
I am on Twitter at Dr. Lisa Jackson.
And Deborah, where can people reach you? Deborah, you're muted.
Sorry, did it again. I apologize. My Twitter handle is at DREGNER, DRegner. Also, I'd like to encourage anybody who needs some support and has a loved one who's currently inside to check out the, there's a COVID-19 connector for people in prison on Facebook. And I believe those links are going to be shared on the Michigan United website also. But if people want to search that, that's a support space for folks.
Fantastic. And Shanae, my twinnie, how can folks reach you?
Well, you can reach me at ShanaeWhitaker@gmail.com. That's 2 T's. But I just also want to add one more thing, and I'm sorry to turn it away. In the state of Wisconsin, they proclaimed racism a public health issue, I think we should do that here in Michigan. I mean, that 8 Mile line, I don't care what anybody says, that 8 Mile line, my heart skips a beat when I jump over that 8 Mile line when I'm in a car. So if it happens for me, it's happened to other people. It contributes to anxiety, hypertension, and things like that. But we need to declare racism a public health crisis here in the state of Michigan. The only way we can move forward is if we make that kind of change. And I hope our governor and a lieutenant governor, they'll be brave enough to take that on. But again, you can reach me at ShanaeWhitaker@gmail.com. I'm also on Twitter at LaFemme. It's LAF as in Frank, M as in Mary, M as in Mary, _Negrita, of course, because I'm Black, at Twitter. Thank you.
All right, thanks, Shanae. And Dr. Duckworth, how can folks contact you?
Well, one of the quickest way, the easiest way to contact me is through our website at gmbcwestland.org, or via email pastorjed@gethsemane.02.org. That is pastorjed@gethsemane02.org.
Thanks, Dr. Duckworth. And Dr. Dede, could you powerfully close for us?
Absolutely, absolutely. I am Dr. Dede Coleman, and I am the pastor of Russell Street Baptist Church in the city of Detroit, as well as a faith ambassador for Michigan United. First, let me just thank all of our guests and this special panel. Thank you for your work that you do, and thank you for your voices in a time such as this. My friends, you have heard heartbreaking stories of those who have gone through and still going through the trauma of this COVID-19 virus. And we hear your cry. People of color are dying at a rapid rate because of the disparity found not only in the city, not only in this state, but this country. I am a pastor who have lost members, and I've lost dear friends in the gospel ministry. I am exhausted. I am exhausted, and I know you are too. I am exhausted of seeing our loved ones leave here because of the lack of testing and the lack of caring for people of color in the richest country in the world. This coronavirus has exposed the world. It has pulled the covers off of neglect. It has extended the arms of racism like never before, ignoring the lack of want in communities of color. This virus has exposed how people are really being mistreated, from the lack of health care to actually being tested for the virus, needing a doctor's prescription for those who have no physician in the first place, who have no health care services. This is a crucial time for us. Death by racial disparity. Why is it that it is a crime to be Black in America? Why must African Americans die for the lack of treatment and the neglect of our poor? We need your help. Michigan United needs your stories to tell the world what it's like to be in the midst of this virus and be Black. Michigan United needs your support to raise awareness of how this virus has exposed how people of color are being treated daily. Most of all, we need your fight. We need you to fight. We need you to fight for equality. We need you to fight to live, just to have a right to live and be treated as human beings. And this is not it. This conversation must continue. We will be calling on you not only to listen, but to spread the word. We will have another conversation on COVID-19 on May 13th regarding death and dying with no closure. If you would like to make any suggestions, any comments, don't make your comments on the side, send them to us. Send them to us, how the quality of life is being affected in your communities with this virus. Any ideas on how we can better our platform, let us know. Please email me at dcoleman@miunited.org. That's dcoleman@mi.united.org. miunited.org. dcoleman@miunited.org. My friends, we want you to share your stories on Facebook and Twitter. Go to hashtag Detroit Rona. Go to hashtag Staying Tall. It will take the whole village to get us through this. There will be no more business as usual. There will be and should not be any more business as usual. Remember, this battle is not given to the strong nor the swift, but to the one who endures to the end. Lakeisha, thank you for being such a wonderful moderator. Back to you.
Thank you for that powerful message. If you haven't been anointed, you've been anointed now, baby. Well, I want to say thank you to Michigan United Political Healers and Faith and Justice teams for hosting this conversation. Thank you to our brave individual speakers and our brilliant panelists. And thank you so much for joining us. For more information about Michigan United, please go to miunited.org. Please stay safe, stay active, and let your voice be heard. Have a great day. Thank you so much for joining us.